Hi, my name is Dr. Jennifer Sears, and I'm the Director of Social Emotional Learning and Mental Health at Penn Harris Madison School Corporation. With me is part of our amazing mental health crisis team, which includes counselors at all three middle schools, our Director of Counseling at the high school, as well as a longtime community partner with Youth Service Bureau. Together, we wanted to take a moment to provide our parents and guardians and the PHM family with some information regarding stress, resilience, and crisis prevention, especially in light of the pandemic, as well as to take this time to inform families of what to do in case of a crisis, specifically related to suicide ideation. But before we get started, I wanted to have each of our participants today introduce themselves to you.
All right. Hi, my name is Autumn Stout, and I'm a school counselor for students with the last names A through K at Montgomery Middle School.
And my name is Tiana Ward. I am the school counselor for students with the last name L through Z at Discovery Middle School.
Hi, I'm Stacy Beck, and I am a school counselor at Schmecker Middle School for students with last names A through K. Hi, I'm Emily Brewer. I'm a school counselor at Schmecker Middle School for last names L through Z.
Hi, I'm Nancy Block, and I am a school counselor at Grissom Middle School and work with students with the last name A through K.
My name is Shay Miller, and I'm a counselor at Grissom Middle School and work with students with the last names L through Z.
Hi, I'm John Westroff, Director of the Counseling Center at Penn High School.
Hi, I'm Lori Ellis. I'm the supervisor of the Youth Development Specialist Program of the Youth Service Bureau of St. Joe County.
In order to provide more information, we want to talk about stress and COVID and feelings of anxiety and ways we can manage all of that, especially within our window of tolerance. We also want to talk about ways to build resilience through all of this by being self-aware so that we know when we need to self-regulate, which will help us connect with others in order to have improved social emotional functioning and have opportunities for growth. Finally, we will briefly cover crisis prevention, especially so our families have some information about warning signs and what to do and where to go to seek help should they need it. So if you remember, earlier in the fall, we talked about stress management and we had a virtual panel on stress. And you probably remember that our bodies are really equipped to handle stress, and that helps us survive. For example, our bodies have a central nervous system, which has the parasympathetic and the sympathetic nervous system. And when the parasympathetic nervous system's in control, we're resting and digesting. And but when our bodies sense a threat or a stressful situation, like say the pandemic, our sympathetic nervous system kicks in, and this causes a series of neurological events in our bodies through our HPA, our hypothalamus, pituitary, and adrenal cortex, and adrenaline and cortisol is released into our bloodstream, and all of these chemicals in our blood help us fight or flight. Have this fight or flight response so that we can deal with the stressful situation, then our bodies return to a state of calm once the threat is gone. However, with the pandemic, we're going through this state of stress, and our stress response doesn't always shut down. So this can cause us to respond in ways that are out of character for us. Maybe we're short-fused or snippy or just kind of grumpy or exhausted. And so we want to talk about what we can do to help ourselves through this difficult time. The truth is our cup is full and our tolerance levels decrease because we are already dealing with so much. So the added stressors, such as the isolation we may feel or the frustration or sadness we feel about not being able to be with our family, for instance, maybe during the holidays, can add stress to our lives. And so we want to, when we feel this sense of stress, it can cause feelings of anxiety. Neurologically, our bodies like sameness, and the changes cause uncertainty. This, can cause us to ask some like what if questions or what will happen if, and that kind of makes us feel like we're losing a sense of control, or maybe we're frustrated that things are happening outside of our control. And we might start to worry or become anxious about things that we can't control. And when this happens, it's important for us to recognize, number one, that what's going on within our bodies and within our minds, And also understand that there are a lot of people out there who are feeling this way right now. So once we're self-aware of what's happening, then we can pause and try to regain a sense of control. We can do this by focusing on what's called our sphere of control. And there's an image here to kind of show that sphere of control. And this is just a simple activity that anybody can do anywhere. So what you want to do is just draw 2 circles. Your inner circle includes all the things that are in your control, such as when you go to bed, kind of your sleep hygiene, your attitude, if you're smiling, if you're following CDC or PHM regulations and guidelines, things that are in your control. And then outside of that inner circle, you want to draw a bigger circle around it. And these are things that you can't control, things that are outside of your control. So it might be what other people say or what they do, maybe how long the pandemic will last, what's going to happen next. Those are things that we can't control. And so once you kind of visually see that, it helps you to focus in on what you can control there, because there are things that you do have control of. And so focus on that. Try to let go of the things that are outside of your control. So this is an activity that you can do, just at home with a scrap piece of paper. You can do this with your child if he or she is feeling maybe some worry or anxiety. You can help them through that situation pretty easily. So next, Mrs. Stout is going to talk about a similar idea with our window of tolerance, and then we'll talk more about what we can do to support ourselves and our children as we take an empathetic approach to support ourselves and others through this time.
Thank you, Dr. Sears. So Dr. Dan Siegel, who is an internationally recognized clinical professor of psychiatry at the UCLA School of Medicine and an executive director of the Mindset Institute, refers to all of this as our window of tolerance. It's the optimal zone of arousal in which a person would be able to function and deal with day-to-day stress most effectively. A window of tolerance is basically a window of how much stress we can tolerate before we lose the ability to process and handle what we're facing. I'm wondering how often you have watched your own children struggle with being able to tolerate what's happening right now. Ever hear of the straw that broke the camel's back? That straw was outside of the window of tolerance. So when you're in your window, your body and brain respond normally and healthy to stress and adversity. In the image in this frame here, the yellow line represents the nervous system and hormone activity. Our body releases hormones to keep us as level as possible, keep us in a homeostasis. If you're in a state of hypoarousal, your freeze response is activated. You feel numb, disconnected, disassociating from life and feeling. You experience memory loss, feel fatigue, not present, lack, and mainly reacting out on autopilot. You're in a state of non-reaction and unable to feel after stress or confrontation. Again, maybe you have seen your own children have behaviors that fit in that zone. If you're in a state of hyperarousal, your flight or fight response is activated. You feel anxious, overwhelmed, angry, full of rage, desperate to regain control, chaotic, compulsive. You cannot react to stress with logic or reasoning. It's as though that prefrontal cortex, in a disconnect with the rest of the brain. You cannot use your logic and reasoning. You're in a state of overreacting and unable to calm down after stress or confrontation. Once again, we're talking about being able to be empathetic with our kids, and maybe as adults we've experienced this as well. And this is just trying to explain more of the science behind all of that. And due to COVID-19, we've been experiencing a marathon of stress. Many people are experiencing what Canadian researchers have just coined COVID stress syndrome. So the key here is empathy. I just want to encourage all of us to respond with kids, respond with others with a great sense of empathy, which includes just listening first when our kids express what they're feeling. If we can even get them to express that, that is good. Dr. Siegel, who I mentioned earlier, says, name it to tame it. And then also, Dr. Erin Leonard, a local psychotherapist and award-winning author who has kids in Jeff, she offers great suggestions for how to best empathy to your kids by, again, listening and validating how they feel and practice, and the more we practice them with our students, the more it becomes habit. And also, pass the on kids as we continue in these slides, the way to practice good habits for addressing.
We've talked about the idea that we might feel some stress and anxiety due to the holidays, and this year with the COVID, that may be elevated. Thinking about our sphere of control and window of tolerance can help us and our children. And now we want to turn our attention to a few more ways that we can cope during this time, as we look at ways to build resilience through self-awareness, self-regulation, and connection with others. Then we will talk about ways to support others who may be in crisis and exhibiting suicide ideations.
So it's safe to say that everyone's life may be a bit chaotic. We're literally dealing with a pandemic and nothing is really normal for us right now. Your child likely feels overwhelmed and like they're unable to manage the high expectations of daily life through their regular methods of using problem-solving skills and coping strategies. It's very important to learn how to successfully navigate your way through those tough times. This can start with developing and building your resilience. Resilience is defined as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, or school stressors. Resilience is important for several reasons. It enables us to develop mechanisms for protection against experiences which could be overwhelming. It helps us to maintain balance in our lives during difficult or stressful periods. It can also protect us from the development of some mental health difficulties and issues. Resilient people are able to look at negative situations realistically, but in a way that doesn't center on blame or brooding over what can't be changed. Instead of viewing adversity as insurmountable, they can focus on looking for ways that you can tackle the problem and make changes that will help. On the next few slides, we're going to discuss different ways that you can build resilience through self-awareness, self-regulations, and with connecting with others.
So as we think about self-awareness, one thing we want to do is define it. So according to Castle, self-awareness is the ability to understand one's own emotions, thoughts, and values and how they influence behavior across contexts. And so the big question as we relate back to the presentation, the idea of resilience is how does it relate to safety and crisis prevention? And so the very important function of self-awareness is the idea that we need to be mindful of one's limits, our mood, our stress, our body, our emotions, feelings, how we sleep, nutrition. All these things are important in terms of how we understand ourselves and then how we can respond to crisis situations, and more importantly, how we can go about understanding the need for help. And so being self-aware and understanding where our limits are, that's the threshold at which we can no longer function at a healthy level, and that's where we need to seek assistance. And so being self-aware can be beneficial for so many things, but as it relates to safety and crisis prevention, when an individual is very self-aware of the stressors that are in their lives, the ways that they respond to those, maybe their level of resilience, that is where we identify the need to reach out for help. And so that's one thing that we want students to be able to do, be able to identify where they're at, have that awareness,
you are concerned is suicidal, show you care and stay calm. Ask directly about suicide. Don't be afraid to say the word suicide and seek help. It is important to ask questions in a non-judgmental way. For example, instead of saying, "You're not thinking about killing yourself, are you?" say, "Are you thinking about suicide?" Without imposing any judgment or criticism in your question, you are more likely to get an open and honest answer. In the slide, you can see other examples of how to ask and how not to ask. In the next slide, we will share some resources, especially if we are at home. During the school day, your child can reach out to their school counselors or the youth development specialists. If you are interested in more information on this, please reach out to your child's school. If you notice any major warning signs that may suggest suicidal ideation, seeking help immediately is vital.
During school hours, counselors and Youth Service Bureau developmental specialists are available, but there are also community resources available. This is not an exhaustive list here by any means, but a great place to start. It includes community resources for family, including general needs, as well as counseling services and crisis intervention services, especially if you're concerned about someone hurting themselves or others. If you are concerned about possible suicide ideation, take every instance seriously. Do not leave the person alone. Offer help and hope, listen, and seek help immediately. And of course, as a parent or guardian, you can also unconditional love and support to your child. Finally, there's also the Safe School Helpline where you can go to report concerns if students are feeling or you notice suicide ideation or other concerns, including bullying or social emotional concerns. The district receives this information and then can follow up for those involved. If you or someone you know is in need, do not hesitate to reach out for help. We know life can present challenges, especially when times are changing, but you are tougher and together we can get through it. Please take care of yourself and each other and reach out when in need.